decisions are in, the debates are over, and global health just changed again. But what actually happened at the World Health Assembly, WHA 2026? At the World Health Assembly, WHA 2026, countries aligned on critical priorities shaping how the world prevents, prepares, and responds to health threats. From universal health coverage, UHC, and access to essential care to strengthening research, innovation, and health system resilience, the agenda reflects a broader shift toward equity and inclusion. This is more than policy. It is the evolving blueprint for what comes next. One of the biggest outcomes is renewed focus on stronger pandemic preparedness. Building on established frameworks for influenza preparedness and biological risk management, countries advanced efforts towards faster outbreak detection, real-time data sharing, and equitable access to vaccines and treatments. Because the next pandemic is not a possibility, it is a certainty. Antimicrobial resistance, AMR, is rising quietly but dangerously. At the World Health Assembly, WHA 2026, leaders reinforced global action through stronger surveillance, better stewardship, and innovation in treatments. Aligned with broader strategies on human immunodeficiency virus, HIV, hepatitis, and sexually transmitted infections, STIs, because infections once easily treated are becoming harder to control. Global health runs on funding, this year focused on sustainable financing, stronger health systems, and equitable access to essential resources, including medical oxygen and blood products, as well as assistive technologies. Without funding, there is no response, and without access, there is no equity. Climate change is no longer separate from health. The World Health Assembly, WHA 2026 advanced action on strengthening responses to climate-linked disease tracking and heat health protection systems, because environmental change is already driving health crises. Digital health is accelerating rapidly, so global leaders pushed for stronger data governance, ethical artificial intelligence, AI, use, and equitable access to digital care. Technology must close gaps, not widen them. Across every decision, one priority stands out: equity. From reproductive health to healthy aging, disease eradication efforts, and addressing the global drug challenge, social participation and inclusion are key. Global health is only as strong as its weakest link. These decisions do not stay in meeting rooms. They shape the care you receive, the medicines you access, and how the world responds to the next crisis. The 79th World Health Assembly, WHA, did not just set priorities, it set the direction of global health. Stay informed, stay prepared. Follow 72 Dragons Health for what is next in global health.